Oh, hey there, this is Dr. Evan Osar. Happy Monday. Hope you had a great weekend. Are your clients doing exercises like that, like the push-up plus on the wall and or on the floor? That is a common exercise recommended by physical therapists, chiropractors, and rehab specialists to improve serratus activation or serratus strength. Serratus anterior, as you are aware of, is one of the key stabilizers of the scapula. Not the only stabilizers, but one of the key stabilizers. The serratus anterior comes off ribs number 1 through 9. It attaches on the medial border of the scapula. It helps to keep that scapula upon the thorax. It helps to posteriorly tilt and upwardly rotate so that the scapula is positioned optimally for overhead motion. For a lot of our clients, they have scapular winging or that forward shoulder position, which is a piece of that or a component of that forward shoulder position. Hello, Karen B. Wales, how are you? Good to see you, my friend, online. Sorry we missed you this year at any live events out there on the East Coast. I know you're doing some great stuff out there with your clients. So, back to the shoulder. So we know that the serratus anterior is important. And if you look at EMG studies, and here's where, a lot of people will say, Dr. Osar, where's your evidence for what you do? Well, there's lots of evidence to show you that the serratus push, or the push-up plus, I should say, where your hands are against the wall like I was just doing, or on the floor where you're kind of pushing the body through the scapula like that, is the best exercise to activate the serratus. But here's the challenge. You can't just look at the evidence and say, that's what I'm gonna do with my client, because that's what a lot of people do when they look at exercises. How much EMG activity or activity on the electromyograph is, or I should say, how much activity is the electromyograph showing, which is basically just how much contraction, how many fibers and how forceful the fibers of that specific muscle are contracting. It's not telling you, is it contracting in the right manner? Is it teaching the individual how to align and control the scapula in the right manner? And if you look at how most people are doing scapular push, or the push-up plus that scapular sort of protraction and retraction, they're not teaching the scapula to control the position. Phoebe's here, it's probably time for her to be fed. Yes, it's almost her feeding time. So I apologize for her incessant meowing that you'll hear in the background. She is fine, she's well fed, she's not starving to death. So if you use the EMG studies, you will say, oh yeah, serratus plus or push-up plus is the best exercise for the serratus. However, we have not found that to be true. If your client has trouble stabilizing the scapula in upward rotation and posterior tilt, which is this motion right here, and that's where most clients struggle with scapular stability, then they're not going to get magically into that push-up plus position either on the wall or on the floor and magically know how to upwardly rotate and posterior tilt their scapula. In fact, this position here will create and perpetuate that anterior tilt and downward rotation of the scapula. I have not seen it yet work to help someone understand how to put their scapula back where it belongs and also then improve stability in overhead function or actually reaching forward. So what is the alternative to that? Great question, glad you asked. One of the best things you can do for your clients is if you take a band, first you gotta cue your client. You gotta cue your client out of this forward shoulder position. Now, also, a part of this process, and again, the process is way more important than your exercise. And that's one thing that we teach as part of the integrative movement system, as part of our integrative movement specialist certification program. It's never about one exercise or a group of exercises. There's no magical exercises. Where the magic is in the process. You have to first assess your client to see what the issue is and where they've lost mobility and or stability. And then figure out what do you need to address first. Because for some clients, it's addressing stability first. For other clients, they need mobility first. You have to release the right structures, the right muscles or myofascial structures that are holding the shoulder into this position. So commonly the lats, teres major, and the other scapular depressors like the pectoralis minor. Then you got to cue your client to get upward rotation and posterior tilt so that way you can teach them where this position is and then how to maintain that position through serratus activation, through lower trapezius activation, with less activation of the pectoralis minor and lats as you do that. One of the best exercises, give me a moment, is just with a band or strap pull apart. Just take a simple strap and or band. Again, it's not the amount of resistance that's important, it's being able to maintain this position right here while your client is pulling gently apart with the band. So in this position, your client should have optimal alignment of their head, neck, and thoracolpelvic cylinder, because again, that's the foundation for the scapula, specifically the thorax, but But the head and neck must be aligned as well because so many of those scapular stabilizers, like upper trapezius, are coming off the head and neck. Then you teach your client how to pull that band apart and maintain this position. Because if they can't maintain this position, then they can't move from this position and achieve optimal alignment and control. Hello, Kate Query, one of our integrative movement specialists. Thanks so much for being on. Thanks for all the great work you're doing with your athletes and clients up there in British Columbia, the Pacific Northwest, where I'll be watching my Seahawks tonight. I'm gonna get crushed by Russell Wilson. Very disappointed in that whole trade there, but that's another topic for another day. So again, back to this exercise here. The band pull apart or strap pull apart is teaching your client to maintain that width across their clavicles, which is the best cue for most individuals, and pull apart and maintain this position. So from behind, you should see the shoulders square across. The shoulders should be in upward rotation and posterior tilt. And then you can teach your client how to move from this position and maintain this alignment. So that way they're aligning and controlling as they learn how to dissociate or move the glenohumeral joint independent of the scapula. Then you can teach them, or in addition, you can teach them how to get aligned on the wall and maintain upward rotation and posterior tilt. So I have my client on the wall, they feel like they're gently pulling the wall apart. And again, that same idea of being wide or open across the front of the shoulder. Because again, that's the cue I'm going to take into all my pushing and pulling patterns. Maintain the width, maintain your alignment, maintain your alignment, then maintain your width, then push and pull, pulling a bit easier than pushing patterns for most clients. Then I'll teach them how to push and pull because that's how you start to train scapular stability. It's not about just squeezing back and down. Yes, that creates stability, but again, think about this. If you squeeze down and back, do this with me, squeeze down and back and try to get your arms overhead. Yeah, it's stable, it's just not mobile. You need to be stable out here as well, and that's where most clients struggle. Getting the arm out here, getting the arm overhead, and then bringing it back down and maintaining scapular control. And when they don't maintain scapular control, they're going into their neck, they're going into their pecs, they're going into other muscles to overwork to compensate for the lack of scapular control. So again, it's identifying what your client needs, it's addressing the most specific things that they need with your corrective exercises, and then integrating this information into the functional pushing and pulling patterns that your clients need to maintain optimal scapular alignment, and then ultimately progress to performing those functional patterns, those pushing and pulling patterns, both vertical as well as horizontal patterns that will help to reintegrate this information into their nervous system. And that's how you become a go-to specialist for your current clients and attract more individuals that need, want, and will pay you for your expertise. And if you're looking for more information, if this made sense and you like this information, check out 2 Anatomy Geeks. Last week on 2 Anatomy Geeks, we covered part 1 of common shoulder orthopedic issues. So we dealt with snapping scapula, we dealt with wing scapula and that forward shoulder position, which is exactly what I just discussed here. I gave you sort of a recap of that first episode. This week, this Saturday, we're covering rotator cuff, biceps tendon, as well as labral issues. But again, rotator cuff, biceps tendon issues, and labral issues are all related to what the individual is doing from a scapular stability standpoint as well as a postural control standpoint. So part 1 covered the overall anatomy and control of the scapula as it relates to the thorax. Part 2 will go into the rotator cuff, labrum, and biceps tendon. We'll cover the functional anatomy. When I say we, Jill Leary, my fellow anatomy geek, and I will be covering that in part 2 here on Saturday. So when you enroll in 2 Anatomy Geeks, you get direct access to the recording from last week, and you get enrolled in this week's session, part 2, this Saturday. And again, if you can't be on live, you get access to the recordings and the handouts, and then we apply for CCs once the 3-part series is done. And then in part 3, we'll demonstrate, or I should say we'll discuss, other issues of the shoulder that many of our clients come in with dislocations. I have many clients consulting with me now that have had chronic dislocations and either had surgery for it or are trying to avoid surgery and trying to restabilize their glenohumeral joint. We'll also deal with, or address, I should say, adhesive capsulitis, so frozen shoulder, and discuss some of the common causes of that, as well as what we can do from a conservative standpoint. And we'll also talk about programming. How do you program some of these components, the corrective exercises and the functional exercise progressions, to help your client safely and successfully work towards achieving their goals? We want you to have a complete program. So we were going to make this about 3 hours. It's going to be closer to 6 hours. We went a little bit over 2 hours in the first episode. We're going to try to keep it around 2 hours or less this episode. And obviously the final episode will be quite extensive as well. So if you're on live, you have an opportunity to ask questions, and even if you're not on live, you can write in your questions and we'll answer them during the live session this coming Saturday at 9 a.m. Central. The link is, I did not put the link in the bio, but the link will be in the bio, depending on where you're watching it, and or reach out to support@discoverIMI. Reach out to Tanya and she'll get you the link and get you enrolled in this series. It is the best series. I guarantee you it's the best series you've learned about the shoulder. And if it's not, you ask after you watch this episode this week or you watch the recording, then just ask for your money back. We'll give you your money back, no questions asked. I guarantee you it's the best information you found in the shoulder. It's the same information I use on my own shoulders to address rotator cuff and labral tears without surgery. It's the same information I teach to my clients in my office. It's the same information we teach as part of our Integrative Movement Specialist Certification Program. So you're getting the best information that we had, the best information that's out there. If I can be so bold to say that. So anyway, thank you so much. There's no obligation if you don't like this series, if you don't feel it fits what you need to do and or what your clients need to do, then we'll give you your money back, no questions asked. But we love to see you in Two Anatomy Geeks. It's a wonderful community. If you're part of it, Kate, I know you are. It's a wonderful community of like-minded individuals who are just supporting each other, looking to up-level our education, our knowledge, so we can better serve our clients. So we'd love to have you as part of this community. And we look forward to seeing you this Saturday. Until then, go out and serve your community. Be that leader that your current clients need and your potential clients are looking for. This is Dr. Evan Osar of Integrative Movement Insider. We'll see you next time. Make it a great day.